Aaron, thank you. With so much downtime this past year, many women found themselves thinking about the future more than ever. For some of them, that future includes a family. Over the last several decades, women have been waiting longer and longer to start having children. Take a look. According to the CDC, from 2000 to 2014, the average age for a first-time mother rose from about 24 to 26. Whether they're married, in a relationship, or single, some women are taking action now to give themselves the best chance in the future. So all new for you this morning, I found out why a local fertility doctor says his practice has been busier than ever, not only with couples who are trying to have a baby, but also with single women who are planning ahead.
We just knew from the very beginning that we both wanted kids.
2020 was a big year for Julie and Ashley Andrews. They tied the knot in September. At that point, they were already in the middle of another adventure.
We've been on this journey for baby since March of 2020.
Just as the pandemic began, they started their journey to motherhood. When things shut down and they had even more time together, that journey only intensified.
For us, when COVID hit, we spent days on days just sitting in our apartment researching.
The quarantine, the downtime, the isolation gives us time to rethink our priorities of life.
Dr. Robert Kiltz with CNY Fertility says Julie and Ashley aren't alone. The number of people walking through the doors of his office proves that.
We've been busier than ever during this last year of the pandemic.
And it's not just couples reaching out. Julie and Ashley are from Texas and worked with the CNY Fertility in Colorado. They're planning to freeze embryos and hoping to start a family soon. But many single women with no plans to begin a family yet use the past year to go through the process of freezing their eggs.
We're seeing the woman in her mid to late 30s who has already been on a career track, hasn't found Mr. Right or Mr. Right now, and has really made a decision that, okay, I'm going to do this. Or in some cases, we're seeing women who are just like, okay, I'm done with waiting. I'm just going to either freeze my eggs or make my embryos and have my baby.
Dr. Kilt says on average, it costs between $8,000 to $20,000 for a single egg harvest and freezing. There are some payment plans available. Many say the cost is well worth it.
We're healthy now. Like, we have no fertility issues. We know we want a larger family. And we also know we don't want them spaced super closely.
It's just a little bit of an insurance policy. Freeze your youngest age you are now and increase your odds for pregnancy later on when you're ready.
Dr. Kilt says with people having more time to talk about the future, he expects the conversation around different ways to start families to continue to grow. The women sharing their story say they're hoping it encourages others to talk about their options and to know they exist.
If I would have known about egg freezing and how the younger you are, the better quality they are, but I didn't know anything about this.
Yeah.
If I would have known, it would have been a game changer. Women have options and they don't know it.
And that really is the point there. Everyone I spoke with said it is so important that we're talking about this because the idea, Ed, not only to inform women, but also to empower them, let them know about all of these different options for family planning that they have.
Right, it's not something to be ashamed of. This is something that a lot of women are actually considering and having that conversation about, and it's important that we continue to have that conversation, especially when it comes to the cost, though they say it's well worth it.